A record number of Americans are in the hospital this morning battling coronavirus. Some of those people will experience symptoms for months. They're called long haulers, and there are a lot of them. Joining us now is Gresko Barclay. She has had coronavirus symptoms for 9 months. And Dr. Norman Gaylis, a rheumatologist who Abby consults. Guys, thank you very much for being here. Abby, your case is incredible. It's a cautionary tale for everyone. What have your symptoms been for the past 9 months?
Well, they've been the traditional coronavirus symptoms that you hear about, as well as ones that were not talked about initially whenever all of this started back in March. I had everything from severe stomach cramping and diarrhea to swollen lymph nodes to an extreme sore throat, shortness of breath, chest pain, muscle aches. It's been all over the place. It's impacted my entire body.
Yes, and your entire life, of course. I mean, you were healthy. You followed a healthy exercise regime and diet regime. You say that you used to walk between 7 and 10 miles a day. Now you can't walk half a mile. And yet, back in March, when you started experiencing these symptoms, there weren't tests available in your area of Florida. And doctors, though you repeatedly went to the hospital, and doctors, they didn't think that you had COVID. Why not?
No, well, initially I didn't present with a fever. I had a temperature of about 96 degrees for 3 weeks. My son had a fever. And that's why I thought that I had COVID. And initially I was calling the health department asking, did I qualify for testing? Because my son had a fever. I had chills. I had chest pain. I had shortness of breath. I had the sore throat. I had the symptoms that were being described as classic COVID symptoms, as did my son, yet I didn't have a fever. And so I repeatedly was told that you would have a fever with COVID and it had to be something else. And so I just, when I felt like I was dying, when I felt like I couldn't breathe, eventually I did start going to the ER. I started going to urgent cares. I started trying to find out what was wrong with me if it wasn't COVID. And it just, it was forever running into roadblocks because the belief back in March was that you had to present with a fever in order to have COVID. And now we know that's not the case.
Abby, that must have been so scary and so frustrating.
Yes, it is still. I mean, I'm almost 9 months into this nightmare that I'm living. I've seen 40 doctors. I've been to the ER 5 times. I've been hospitalized twice. I still don't have answers because where I'm left is doctors have to go through the process of elimination of figuring out what else could it be since a test wasn't available to me back in March, even though I know without a doubt it's what I had. My son was sick, my husband was sick, my daughter was eventually sick. We had friends that were in our social network that had similar symptoms that we had. And so I don't have any doubt that COVID is the cause of the nightmare I've been living for 9 months, yet here I am still trying to get answers.
Dr. Gaylis, what do you say to Abby? And is there any doubt in your mind that she has been suffering from COVID for the past 9 months?
So Abby is actually very representative of, unfortunately, a number of patients. If you really think about it, maybe the statistics are 10% of anybody who got COVID becomes a long hauler, so to speak. And I say to Abby that she probably, without a doubt, had COVID. The fact is that at that time, when she first presented, there were not sufficient testing or encouragement to do testing being done. So she missed the opportunity or the window of diagnosis. But nevertheless, her circumstances, a healthy woman with all the family around her getting ill, I mean, you've got to look at the fact that we're in a pandemic. It is true that when people present with multiple symptoms, and we know that post-COVID you can get multiple organs affected, that it is very difficult for physicians sometimes to kind of get through the fog of what is really happening. But ultimately, you've got to look at reality and statistics. She was in an environment where COVID was rife. Everyone around her was symptomatic. She had really most conditions ruled out. It wasn't that she didn't have testing done. And so I think, you have to get to a point, and we are doing this, where we recognize the testing is not infallible. It's not 100%. We get lots of false negatives. And in fact, studies published in New England Journal, Oxford University have all shown that you can have COVID without a positive test.
Yes.
So in terms of Abby, I think she's got the symptoms of post-COVID. And certainly, I mean, I haven't really put my, my toolbox of treatments to test on Abby, but I think we should. And I think she just represents so many people like her.
I do too. I do too, particularly that it's gone on so long. And Abby, we really feel for you. I'm sorry that we're out of time right now. I'll put this out on my social media, your story, because again, I think people are really interested in everything that you've had to endure. And I'm sorry that you've gone through all of this. Dr. Gaylis, thank you very much for all of the information. CNN's coverage continues right after this.